This is going to be a controversial topic, and this gets to the heart of whether obesity itself is a disease, or if it's a risk factor, or if it's nothing at all, if it's just a phenotype, meaning a normal variant of human beings. I'm going to dive into this deeper by talking about something that is called metabolically healthy obesity and what it actually means. But first, who am I? My name is Dr. Lindsay Ogle. I'm a board-certified family medicine and obesity medicine physician, and I founded Missouri Metabolic Health, where I help patients improve their metabolic health by optimizing their lifestyle, achieving healthy and sustainable weight maintenance, and treating their chronic medical conditions. So this topic is extremely interesting to me. Essentially, do we need to treat everybody who has obesity? I don't think that we do. There's a movement, Healthy at Every Size, which aims to destigmatize obesity, which I think is a great thing. And us in the obesity medicine field are trying to do the same work as well. The big difference in obesity medicine is that we see obesity as a disease, something that negatively impacts the health. And that's both from a adiposity, or we call it sick fat disease, where the actual cells themselves are secreting inflammatory markers and endocrine signals to the rest of the body to cause dysfunction, to cause inflammation, insulin resistance, to name a few. Increasing risk of other conditions like type 2 diabetes, cardiovascular disease, blood clots, stroke, etc. The extra weight can also cause fat mass disease, which is when the extra tissue itself, the weight of the tissue, can cause conditions such as osteoarthritis. But I think all know people who fit in the obesity category and are healthy and feel great and fine, which is wonderful. And we don't need to worry about that. But there's a key difference of people who meet obesity based on BMI and are metabolically healthy, and people who meet obesity with BMI criteria and are not healthy. I want to go over some of those differences here. One of the main ones is where they carry weight. We know that the most dangerous type of fat is visceral fat. So this is fat disposition in our organs. Most commonly, we think of fatty liver disease. This is becoming more and more common, and often it gets ignored. And it may be one of the first signs of metabolic dysfunction and is quickly becoming the leading cause of people who need a liver transplant. This is something that absolutely should not be ignored and should be addressed. Fat disposition happens in other organs as well, like the pancreas, which is likely leading to insulin resistance. Fat can get placed on the kidneys, which can affect kidney function and blood pressure. Fat can deposit around our throats and cause sleep apnea. It can also deposit around the heart and lead to heart failure. So that type of fat accumulation is obviously dangerous, but the fat accumulation just under the skin doesn't tend to be as damaging as the visceral fat. We call the fat under the skin subcutaneous fat. That's the type of fat that's removed if somebody has liposuction. Liposuction will help somebody lose weight, might make them look better in a bikini, but it's not going to improve their metabolic function. It's not going to change their overall health. So how do you know where you're carrying your fat? You can get a fancy DEXA scan, which at some locations costs around $100. You can do a body composition analysis. Some obesity medicine clinics have it. Some gyms have them. Their accuracy varies, so it's something that you want to be aware of. You can also take a waist circumference. If you are carrying a lot of your weight in your belly around your waist, then it is more likely that you'll have more visceral fat. If most of the weight that you're carrying is in your thighs or hips or butt, that's most likely subcutaneous and less likely to cause an issue. So we think of body types like the round body type or the pear shape And the pear shape is less likely to affect your health than the round or apple body type. We also see that over time, people who met the metabolically healthy obesity category, over time, many of them turned the corner to metabolically unhealthy. So there definitely is a time component, how long you have obesity, how it impacts your health. Now, I don't want to get too much into the weeds here because it's not clinically relevant, meaning that we can't really measure these things, but these are things that are studied in scientific studies and research. And I'm going to show you here the difference between somebody who has excess adiposity or obesity and it is healthy obesity versus somebody who has excess adiposity or obesity that is metabolically unhealthy. And you'll see that the one that is healthy has more fat cells and they're smaller and they're insulin sensitive and they have what's called normal angiogenesis, meaning that they have plenty of blood vessels to supply them energy, nutrients, oxygen, allowing them to function well. They're dividing normally. That's the normal adipogenesis. But either over time or due to genetic causes or reasons we're still learning, the fat cells, the adipocytes, change. They start to become larger and block their blood supply, which decreases the amount of oxygen that they have. They start to be stressed out and release inflammatory markers, and they can die and become scarred. They start to cling on to organs. This can lead to the metabolically unhealthy obesity. And what's very interesting is this is a fluid process. Here is an example of somebody who has gone back and forth from metabolically unhealthy obesity to metabolically healthy obesity, back to unhealthy, and then back to healthy again. And what we do see is that it was the weight loss and gain that was the variable here, which leads us to assume that there is a tipping point for most people, that they can be metabolically healthy until a certain BMI, and that can be different for everybody based on their genetics, their nutrition, their environment, their medical conditions, the just different exposures that they've had. It can vary from person to person, but they'll hit that tipping point and they'll start to have signs of metabolic dysfunction. Their cholesterol will be abnormal, blood pressure goes up, blood sugar goes up. They have increased inflammation or puffy, less energy, poor sleep. But the good news is weight loss, even a 10% weight loss. So if somebody weighs 200 pounds, that's 20 pounds, dropping that 10% body weight can bring somebody back to the metabolically healthy state. You don't have to have a normal BMI to be healthy, but there is a healthy weight for you. So you really need to find a doctor who understands this and is going to treat you in an individualized way. There is no one size fits all. Our goal is to find your best weight, the weight that you feel healthiest in, that you are healthiest in, and that we can sustain over time. If you're looking for somebody, I see patients in Missouri, but I'll also include a link where you can find an obesity trained physician near you who can help you achieve this metabolic health that you deserve. I wish you all nothing but the best. I wish you a happy, healthy, fulfilled life, and I can't wait to see you next week.